All right, everyone, thank you for joining our presentation today. We're going to go ahead and get started. Today, we're going to be talking about practice transformation and discussing why it's important to consider for your practice. Please feel free to chat in comments and questions during the presentation, and questions will be answered at the end of the webinar. Just to note that you entered the call unmuted today. You can use the controls at the bottom of the WebEx to mute and unmute your line. Gary, I'll let you do the next slide.
We welcome chat and questions during the presentation. Please use the chat box to type in your questions or comments throughout the session today.
All right, thanks, Gary. Thank you again for joining us. First off, just a little bit about KFMC and Gary and I. My name is Tammy Elliott. I have 28 years experience in critical access and hospitals and rural health clinics as a staff nurse, care manager, utilization review coordinator, and clinical informatics.
My name is Gary Carter. I have about 20 years experience in healthcare and also a little bit newer background in health IT. And I've been here at KFMC about 3 years and working on all your SRA and policy and procedure help.
All right, thanks for that, Gary. Now a little bit about our organization. The Kansas Foundation for Medical Care, otherwise known as KFMC, is a not-for-profit organization focused on improving healthcare quality. We've served as contractors for the Centers for Medicare and Medicaid Services Quality Improvement Network since its inception. Some of you may know us from previous CMS projects around infection prevention and reducing readmissions. That was actually my first exposure to KFMC before I became a consultant with them. We are also contracted with KDHE to support eligible Medicaid practices in promoting interoperability, previously known as meaningful use. We can provide HIT and practice transformation services free to qualified medical practices in Kansas. Now a little bit about this series. Each session will be no more than 45 minutes long, as we know time is a precious commodity. Each session will have time at the end for open discussion and questions. Because this is a small bites series, we will cover 1 to 2 foundational elements of practice transformation in each subsequent session. By taking small bites with each session, this will allow you to take achievable, incremental steps in your practice. This series is designed with the small practice in mind, knowing that you have limited personnel and financial resources. As we get started, I want to share the quadruple aim with you. Most of you are already familiar with it, I'm sure. So the quadruple aim is an approach developed by the Institute for Healthcare Improvement. The 4 aims are better outcomes at lower costs with improved patient experience and improved clinical experience. Practice transformation serves to help your practice meet all of these goals of the quadruple aim. So why are we talking about all of this now? The value-based payment train has left the station and it's not slowing down. You're faced with a choice. You either jump on the train or you get left behind. We have seen during the shift in care delivery during the COVID-19 pandemic that practices who were engaged in alternative payment models, especially capitated payments, generally fared better than offices that relied on fee-for-service payments only. The Healthcare Payment Learning and Action Network is a public-private partnership launched by HHS in 2015 and is an active group of public and private healthcare leaders dedicated to providing thought leadership, strategic direction, and ongoing support to accelerate the care system's adoption of alternative payment models. The Learning and Action Network mobilizes payers, providers, purchasers, patients, product manufacturers, policymakers, and others in a shared mission to lower care costs, improve patient experiences and outcomes, reduce the barriers to alternative payment model participation, and promote shared accountability. In 2019, the network announced new goals for shared accountability alternative payment models. They are based on models that include downside financial risk in the alternative payment model framework, which represents payments from government and private insurers to healthcare providers. As you can see, by 2025, the goal for this advisory group is for 100% of Medicare and 50% of Medicaid payments to be based on value, not volume. As healthcare costs rise, your practice needs to be prepared to deliver care in ways that reward quality over quantity. We want to help you get to that point before you have to be there. So one of the main goals of practice transformation is to improve outcomes. If we improve outcomes, then the long-term expenses should decrease. I do want to stress that lower cost does not mean less care. Instead, it is the right care at the right time in the right setting. Now, let's talk about measures that many of you might be reporting for quality programs. Most of you are familiar with process measures. These are what you do. You can see the example in this slide. They're often screenings and based on best practices and protocols. Outcomes measures are what happens as a result of those process measures. For instance, if you act on the results of your depression screenings, you would expect to see a change in depression remission. As you monitor hemoglobin A1C and then treat patients accordingly, you would expect they would have better diabetes control. If a practice is providing proactive care, you might see prevention of avoidable ED visits. So you can't just look at the number of screenings to determine how you're doing in outcomes. You have to harness other data sources such as payer and EMR reports. And an important point to remember is that process measures are really just check the box activities until you actually act on those results. When we talk about better outcomes, they can be sorted into buckets. These are not all inclusive, and I'm sure you can think of other outcomes. One that's not listed here is patient and provider satisfaction, which is also part of the quadruple aim. Clinical quality measures are those measures that deal with how your clinic is managing patients with certain conditions. And these probably look familiar as they are all MIPS measures. Utilization measures are those measures that tell us how our patients are utilizing healthcare. If they're getting the right care at the right time, for instance, preventative care at your office, then hopefully their ED visits and their inpatient stays will decrease. And overall, we hope that the better outcomes lead to lower cost. So this is a great way to visualize how impacting clinical quality measures can impact costs, and they really do all flow into each other. So if your practice can proactively manage patients with chronic conditions, then you can prevent unnecessary ED and hospital visits, which in turn will lower your overall healthcare costs. And as future payments from insurers shift more to outcomes, this becomes imperative for your practice to address. So we've talked about why. Now let's talk about how. These are the steps in practice transformation. These steps are not in any particular order. They're really all done simultaneously. However, you do need to identify your patients as your first step. Now, don't let this list scare you. It's important to note that your practice could implement only a small few of these steps and still effect change. It's not all or none, but the more invested you are in the change, the more impactful your outcomes will be. We're going to cover each one of these a little more in the next few slides, and each subsequent webinar in this series will dive into one or two of these more in-depth and help your practice to implement steps. As I just mentioned, you first need to know which patient your practice is responsible for. You can't do any of the following steps without first identifying your patients. And it's important to note that not all of your patients in your files or your EMR are your patients. They may have come to your clinic for a one-time acute visit. You want to be sure that you eliminate those patients from your patient list so that you can more efficiently reach out to the patients that you are truly responsible for. Now, once your patients are identified, do they have a PCP? And if they don't, How do you know who will outreach to them proactively to close gaps in care? Access to care is important because the first step to reducing unnecessary ED utilization is improving access for your patients to their care team. So, does your practice have after-hours access, or do patients seek care in the ED for minor issues? In our next session on October 20th, we will discuss how to identify which patients you're responsible for and how to assess who needs outreach. Additionally, we will discuss how access to care can impact emergency department utilization and explore creative ways to enhance access and communicate with patients. Now, thinking about care management, does your practice provide care management services? If not, how does your practice manage patients with chronic illnesses? How can you better provide care for them between office visits? Proactive engagement with high-risk and rising-risk patients can prevent ED visits and inpatient stays, as well as prevent long-term complications of chronic diseases. And as you look to enhance access for patients and provide care management, it's important to leverage the strength of every member of your care team. Team-based care allows every team member to practice at the top of their license and allows providers to deliver the level of care that only they can deliver. On November 3rd, we will discuss the differences between longitudinal and episodic care management and how to utilize team-based care to ensure workload does not fall all to one role or one person. Now, we know that your practice isn't in a bubble. You share care of your patients with others in the medical community. By collaborating with local hospitals and specialists, you have the potential to avoid duplication of services, improve communication, and ultimately deliver more comprehensive care to your patients. And we need to remember that patients are the center of your practice, so they should be the center of their care. By engaging them in their own care, they claim more ownership of it, and this can lead to better management of their overall health. On November 17th, we'll discuss how to choose what community partners to target for collaboration and how to foster collaborative care. We will also discuss tactics to engage patients in their own health care. Now, do you experience data overload and fatigue? I know I certainly do. Data is coming at you from multiple sources. However, not all data is helpful. However, if you have the right data, you can assess progress and improvement activities and identify other areas that need your attention. On December 1st, we will explore what data sources you have, which ones are the most valuable, and how to use them to effect change. So I know what you're thinking, not another project. I get it. Change is hard. But this is a change that is worth making, and it will have long-term benefits to your practice and to your patients. So that being said, let's look at ways to implement practice transformation that will help with the resistance to change that you might encounter. Keep in mind that you can use these change steps for any change you're making in the practice. So with any change, it is imperative that you have someone who's leading the charge, someone who is the coordinator of all activities. They aren't necessarily doing all the work, but they have that in-depth knowledge of the change you're implementing. This person is your champion. And we want to stress communication. It is not possible to over-communicate, and transparency with staff is vital. They need to know why you're making this change. Without the context of the why, it's going to be very difficult to get buy-in. And as you think about staff buy-in, think of those that you need to get on board and advocate for the change. These include your formal leaders, such as your providers and managers. But don't forget about your informal leaders. These could be any staff member that others respect and listen to. And if you get your naysayers on board, then you're golden. It is important to communicate with all staff, not just those that are directly impacted by the changes. Even if someone isn't working with patients on chronic disease management, it's still important that they understand why your practice is doing this if you've never done it before. And it does no good to implement a change if you don't monitor the impact it's having. As you embark on the practice transformation journey, you should establish metrics to which you will gauge your progress. As we talk more about each step in the practice transformation process, we will help you to decide what those metrics could be in your practice. Some are easier than others, such as hemoglobin A1C control or the percent of patients who receive a certain screening. However, others may be much harder, especially as you look at utilization measures. Again, we can help you to establish those metrics early on. And then it doesn't do any good to measure if you're not doing something with the results. So you want to be sure to communicate those to your staff and seek their feedback on why something's working or not working. Also, be sure to check in with staff and see how the change is impacting them. Maybe you've made a change that's great for the patients, but there's something in the workflow that's really frustrated your staff, and their feedback is going to be crucial to your success. Lastly, you should not think of practice transformation as a project with an end date. You're never really truly done. You will be continuously monitoring your progress through your metrics. And as staff get used to the change and you hire new staff, you might experience some backsliding in some of the changes you implemented. With check-ins and communication with staff, hopefully you can minimize that backsliding. So what now? These are some questions that you should be thinking about as you explore practice transformation and how it can be implemented in your practice. First of all, whose support is critical? Who do you need to have on board in order for others to have buy-in? Which team members have passion and can lead that charge? Yes, you need a designated champion, but do you have staff that are passionate about improving patient care? And can they be delegated to lead a part of the change? Be sure that these crucial team members are invited to future sessions or watch our recordings. And note that our team is always available for tailored practice transformation consultation. Now we will address any questions that have come up in chat. Gary, do we have any questions in chat?
We do not at this time.
Okay, then I'm going to move on to the next slide. Thank you. So we want you to join our team. We're looking for practices to work with us on our practice transformation project. You will receive tailored support from KFMC consultants, workflow and process analysis services, data analysis, and HIT consultation. And this service is free for eligible practices. To learn more, you can email us or visit our webpage. On October 20th, we're going to talk more about how to identify your patients and how to access care, how to enhance access to care and improve that access. Here is our contact information if you'd like to reach out to us directly. And then we also want your feedback. We do really value your opinion. So the link to the Postevent survey has been put into chat, and we'll also be emailing a link to all of you along with the slides. And that concludes our presentation today.